Remember, and I do not want you to forget this now for the rest of this show. Deborah Birx just said the profile is matching Italy identically. That we are going on the same path. We're watching exactly what we saw in Italy. That's why I showed you the Italy numbers again. Now remember, just to burn it in, this is what we know about Italy, that 99% of the cases had comorbid issues, things that they were likely going to die of anyway, and they just happened to be dying with COVID-19, not from COVID-19. And they're downgraded as they look at the numbers. They say, we've got to really just say that it's about 12%, that 88% of the cases appeared to really just be dying from those comorbid issues. This is massive. It's important. Remember that 99% number. Remember, Deborah said we're matching them identically. Well, that's exactly what the CDC just put out. This is the CDC's preliminary estimates of the prevalence of selected underlying health conditions among patients with coronavirus disease. Okay? This is their conclusion. Among all COVID-19 patients with complete information on underlying condition or risk factors, 184 deaths occurred, 173 deaths of those above the age of 19. 94% were reported among patients with at least one underlying condition, almost identical to what they were saying in Italy. In Italy, it was 99% of cases. The CDC's own look at this is saying 94% of the cases seem to have a comorbid effect. This was discussed in a piece on BBC News that went on to say coronavirus deaths, what we don't know. And in this article, do we have the article? He goes on to say the coronavirus deaths will not be in addition to these. As statistician Professor Sir David Spiegelhalter, an expert in public understanding of risk at the University of Cambridge, explains, look at this. There will be substantial overlap in these two groups. Many people who die of COVID, the disease caused by coronavirus, would have died anyway within a short period of time. This is exactly why Bhakti was setting off an alarm and sending a letter to Merkel. Very quickly, let's just look at his last line of his discussion in his letter. He said, we know there's a problem. My question, has Germany simply followed this trend of a COVID-19 general suspicion? And is it intended to continue this categorization uncritically as in other countries? How then is a distinction to be made between genuine corona-related deaths and accidental virus presence at the time of death? Remember, the question is, yes, you may have coronavirus. And by the way, if you're in a hospital for your heart condition or anything else, and COVID-19 is running rampant now in those hospitals because that's why people are showing up, odds are if you didn't have it, you could catch it. This is a known factor when fighting any sort of illness like this. But despite the fact, we have a sense that whether or not you have COVID, you're not dying from it, as we know from Italy. And Birx is saying we are seeing the exact same trend here. This is very, very important because just this morning we saw the New York numbers. Now, this is from the 28th, a few days ago. They showed us an entire chart, a sheet on the numbers. I want to show you something because it explains exactly what's going on here. Take a look at this. This is the daily data summary from, this is yesterday's now, April 1st, okay? The data in this report reflect events and activities as of April 1st, 2020 at 4:30 p.m. All data in this report are preliminary and subject to change as case continued to be investigated. These data include cases in New York City residents and foreign residents treated in New York City facilities. First of all, look how detailed it is. We have the age groups, 0 to 17, very low rate of infections. 18 to 44, 45 to 64, 65 to 74, 75 and over. You see exactly what they're saying. Older people are dealing with this. But look at the underlying conditions. How many of these people, once you're at 45 years and older, up to 64, you know, all of these people have underlying conditions. Look how few have don't have underlying conditions that are, these are the deaths, remember. 0, 4, 9, 1, single-digit numbers compared to mid-hundreds, meaning basically exactly what we were seeing in Italy. The people that are dying with underlying conditions. This is a major, major concern that Bhakti is pointing out. How can we know what the actual death rate of COVID-19 is if we are not going to be very, very particular about separating those who had pre-existing conditions. Well, we went to our own websites to try and understand what significance pre-existing conditions have. Now, again, I'm going to try and show you. For those of you that are watching this show and maybe you're getting bored, this is way too many details, then this show isn't for you. We are all about the details. We geek out on the details because it's all about the details. Our lives are hanging in the balance. Whether or not we have jobs in the future and what happens on this planet is all about details. So we tried to find the numbers. We tried to find the significant numbers. How many people died? What was the death rate like we have at Euromomo? Well, when you go to the CDC's website, they are not as good at it. Unfortunately, when we typed it in, this is what we had to do. We went to https://wonder.cdc.gov. We went to detailed mortality, okay? You can do this too. You have to agree to their terms. Now, we want to do a search, right? So what we searched for was the 15 leading causes of death. And then we want to do it for the most recent year. I wish we could have done 2019 or 2020, but 2018 is all that's been updated, so we selected 2018. And here it is. Here are the top causes of death 2 years ago in America. These would be your comorbid conditions. Now look at that. At the top of the list, as we all know, is diseases of the heart. 655,000 people in America died in 2018 from heart conditions. Certainly heart conditions would be a pre-existing condition. We also know that those people that are on ACE inhibitors are at higher risk, it appears. There's studies coming out and people investigating because ACE2 is where coronavirus rides. I'm not going to get deep into details, but you could be at heightened risk. But what if you have coronavirus and a heart disease and you're in the hospital? If you die, are they going to list it as a COVID-19 death? Now look just 4 rows down. This is an extremely significant number. Chronic lower respiratory disease. These are all the respiratory diseases that are basically below your neck, meaning your lungs. So asthma and COPD. In 2018, 159,486 people died of lower respiratory disease. Now let's go down 2 more places to diabetes, because we're hearing that a lot of people that are dying in this death rate are those that are severely overweight, older, and suffering from diabetes. Well, diabetes kills nearly 85,000 people a year. And then you can, what else do we have? We have flu down there, right? Can I find it? Where is it? Right below diabetes. Oh, there it is. Influenza. I'm looking for flu. It's called influenza, Del. Influenza and pneumonia. There we go. 59,000 people. So just think of those categories. These are all people that will easily have comorbidities with coronavirus. 59,000 for the flu, 85,000. So it's roughly 140,000 now if you add in diabetes. Then we go to chronic lower respiratory, another 160,000. So there were 300,000 potential comorbidities. And then you go to heart disease, 655. You're at nearly 1 million people that are going to die, just as it was said in that piece from the UK, that are going to die anyway this year. What happens to your numbers if COVID-19 is in there? Now, certainly you would want to be really defining the difference so that you don't list people that were going to be dying of heart disease, right? So that we don't bolster these numbers. Because we're saying 100,000 to 200,000 are going to die in America if we do everything right. Now, I want you to think about this, that if those are the numbers, that those are the comorbidities, then we're looking at exactly what they're talking about, right? So how are we listing the deaths? How is this getting listed? I'm hoping, just as Bhakti is in Germany, we're all hoping America's going to be really, really tight about this, right? We're really going to nail it down. Well, I want to go back to something we just touched on last week, and that was the CDC advisement talking about how to categorize a death for COVID-19. This is the guidance for certifying COVID-19 deaths. And what it goes on to say, it is important to emphasize that coronavirus disease 2019 or COVID-19 should be reported on the death certificate for all decedents where the disease caused or is assumed to have caused or contributed to the death. So they literally tell them right there, go ahead, and even if you're assuming, if the test didn't come in and you have to assume. Now, it goes even deeper because we didn't really look closely at the death certificate itself. And I want to look at that because it tells you how to fill this out. This is very important. Remember, we want to be selecting out whether you died of heart disease or a lower respiratory illness you already had, right? Here's how it tells you to fill it out. Can we bring up the death certificate? If the decedent had other chronic conditions, such as COPD or asthma, which would have been the 159,000 people that died in 2018 or virtually every year, that may have also contributed, these conditions can be reported in Part 2. In Part 2, what does that mean? Part 1 and Part 2. Well, here we look at the death certificate. In Part 1, you will see that's the top section here, and they tell you how to fill it out. So this patient, I'm imagining is an imaginary patient, had an acute respiratory distress syndrome for the last 2 days, so obviously they were going into a major problem. They also had pneumonia for 10 days, and they were diagnosed with having had COVID-19 or assumed to have had COVID-19, which is what they tell you, right? So put that in the top group, and what you're going to list this as is a COVID-19 death. Now, if they were suffering from something else like a heart disease or COPD, which they told you with an acute respiratory illness, put that in Part 2. Part 2, the less significant part of this document, meaning it very well will read not COPD killed you or some other lower respiratory illness you were suffering from, but we will list it as coronavirus. You may think that I'm pushing this, but this is the actual document that was sent out. And they really doubled down. Last week, we were just showing you what they were recommending, but they actually came out with an exact coding now. The coding. Now in every hospital, here it is, saying we have a code for COVID-19. This is the article. The new ICD code introduced for COVID-19. This was March 24th. Remember, March 24th is right about the time you start seeing the COVID deaths exploding. Right there. Look at March 24th. It's right at the beginning. Did the deaths explode, or did we have a backlog that couldn't code it, is number one question. Once we start coding, this thing blows up through the roof. And the letter goes on to say to everybody, make sure you give this new code to everybody that was collecting it. What happens, all right, and here's what it goes on to say. For those questioning, how do you use this new code, right? What happens if the terms reported on death certificate indicate uncertainty? If we have a question, look what it says. If the death certificate reports terms such as probable COVID-19 or likely COVID-19, these terms would be assigned the new ICD-9 code, meaning it doesn't matter if you were guessing at it. Doesn't matter if you just thought maybe it was COVID-19. Put in the ICD-9 code. And in case you're worried about backlash, look at this sentence. It is not likely that NCHS will follow up on these cases. What? It's almost like they're saying, you know, go ahead and call it COVID-19. We're trying to bump these numbers up a little bit. And don't worry, it is coming from us. Obviously, we can't say that. But what we're saying to you is, even if you think it's likely, even if you don't have a background, you don't have a test to prove it, and there's uncertainty, just put the code in there and don't worry about it, okay? Don't worry about it. We'll take it from there, and you will never get called out on this. If you think that that's not enough, they double down on this. They say it over and over again in this paper. In fact, I think it's best exemplified by how they try to emphasize what they want you to know. When you look at this entire letter, there are literally only 2 sentences that have been bolded in the entire letter. The top, new ICD-9 code introduced for COVID-19 deaths. Go all the way down, and there at the bottom, we want you to know, assumed to have caused or contributed to death. Use the code even if you're just assuming it's a COVID-19 death. You cannot make this stuff up, folks. These are the real facts. These are the real documents. And so now I want to talk about human nature. I want to discuss, you know, what is this going to do to our numbers? Because if, as we're hearing a great question, are you saying there's going to be 90,000 deaths in the next week? Is that really what we're going to see? And by the way, it's not just mainstream media that's reporting this incredible rise. There are very dramatic predictions by people in social media, some even in the natural health movement that are saying body bags are piling up. You know, thousands and thousands of people are going to be dying. But that's always been true. Thousands and thousands of people are always dying in America. 655,000, in fact, from heart disease. 160,000 from respiratory issues. 90,000 from diabetes. You know, we went through it. Those are all deaths that are happening right now as we speak. So at any given moment, you could say, look at the bodies piling up, right? But what does this mean for us? Let's go back and look at this chart one more time in New York. Can we bring up the chart that we got out of New York, just so it reminds people that, remember, if you're a doctor now and you're in one of these hospitals, you know, 0, 4, 9, 1, 4, those are the people that actually only have and are dying of COVID-19. Those are the ones you would have been sure to put on the certificate. But all those, the 75 and over, with 431 underlying conditions, 257 underlying conditions, this document is telling you, go ahead and list them too. And why would that be important? Imagine what's going on. If you were watching the news, you know that there's some argument that there's a lot of fighting going on between governors that are all bidding on the same respiratory equipment and masks and things like that. Funding's going out to all these different hospitals. And even Donald Trump is saying, look, yeah, he's being blamed. You're holding on to the respiratory equipment. He says, you're right, I am, because I need to see where the crisis is happening. We can't send a bunch of, respirators and materials over to someone that doesn't have a crisis when it ends up being over here, and then how do we get it back? It makes perfect sense. But now imagine you're a governor of the state of Texas or the state of Michigan or somewhere else. You don't want to be the state that didn't have enough equipment if this virus ends up being what Neil Ferguson had, exaggerated it to be. You don't want to be the one holding back. And by the way, if you're the head of a hospital, do you want to be the one that came up short on respirators or on drugs or on chloroquine or any of these things? No, you do not. So when the President of the United States and the CDC is telling you, look, we're going to give the equipment to those in need, those in crisis, what do? You tell your staff, we need to show a crisis. Whether or not it's happening now, we don't want to be left naked, all by ourselves, unable to protect ourselves. So go ahead and do what the CDC just told you you can do. List everybody that has died with COVID-19, even when you know it's not from COVID-19. Tell me that's not happening. Tell me I'm exaggerating that. You know, in whatever business you are, if the authorities, if the FCC or anyone gave you the ability to go ahead and ramp up the crisis as much as you want and say, we're never going to investigate your numbers, we're just going to send you whatever materials you need if you look like you're in crisis, then I think the odds are that we are going to be in even worse diagnostic numbers and understanding than Italy, because CDC just went out of its way to bolster the COVID-19 numbers. I don't know why. I don't know what's behind it, and I guarantee you in the weeks to come, we're going to start trying to investigate what would be the motivations when we are in the middle of a crisis. And it seems that if people really cared about the United States of America and our future, and whether or not we have an economy and an ability to protect ourselves, we would want to know if this has just been over-exaggerated as soon as we can find out. Because remember, all they keep saying is, we just don't have the data. We just don't know the numbers. It's really hard to tell how many were asymptomatic carriers. We know that in Italy, it's really hard to tell how many actually died of the disease or had comorbid issues. But you went out of your way to bolster the COVID numbers in a way we have never done that before. And so then in the end, don't you have to question the numbers that you're looking at right now? the thousands of deaths as we speak in New York and around the world? Don't we have to question it? Don't we have to start attributing at least the mathematical principle coming out of Italy? Because if, in the worst case scenario, Dr. Andrew Fauci and Deborah Birx are saying it could be as high as 250,000 deaths, I just showed you how easily we can get to that number. But if you multiplied 250,000 potential deaths by the 12% that they're using in Italy, and I'm guessing they're going to do a similar thing in Germany, that means your 250,000 deaths really from COVID-19 was probably more like 30,000 deaths. Well within side of a flu outbreak, just as, we heard from Dr. Fauci. There it is. The deaths acceptable by the CDC every year between 12 and 61,000. If we were to do the math as it's done it in Italy, we are right in the middle of that. It's true, Dr. Fauci, this does look like a very serious or somewhat serious flu. No doubt people are dying, and some of coronavirus. But we're really going to have to question these numbers now. And remember, as the numbers keep coming down, and Neil Ferguson brings down his numbers, he has, of course, started defending himself and saying, what I meant was it's 20,000 now that we're in lockdown. Folks, UK was in lockdown for 1 day before Ferguson dropped it from 500,000 to 20,000. We have no idea if lockdown is working at all. And I want to advise you that the former, creator, one of the creators of the Cochrane collaboration, Dr. Peter Gutcha, put his name on the line that we presented last week. I mean, this guy has more, credits than you know what to do with. He says, should it turn out that the epidemic wanes before long, there will be a queue of people wanting to take credit for this. And we can be damn sure draconian measures like quarantine will be applied again next time. But remember the joke about tigers. Why do you blow the horn? To keep the tigers away. But there are no tigers here. There, you see, it worked. Folks, Fauci and Birx, maybe even Donald Trump, and all the people around the world that went out of their way to destroy our economy are going to try and tell you it was because we had lockdowns. But everything in the math and a growing body of international scientists are telling you otherwise. They're saying, be careful, it was never in the numbers. The real numbers never showed this. And even though Bill Gates wants to lock you down for another 6 to 10 weeks, he has no real numbers to defend it. Are they going to try and bolster it? Probably. But the big question will be, when the numbers do come in, and if we do apply an equation like it's only 12% when we really look at it, and we come in at 30,000, how many people will say that the lockdown was what did it? Really? How effective was that lockdown when Prince Charles ended up getting COVID-19? When the Prime Minister of England ended up getting COVID-19? And here in America, the same. In fact, even our very own CNN's Chris Cuomo, somebody who went out of his way to say we all need to make this sacrifice. We all need to lock ourselves down. There it is, CNN host Chris Cuomo, brother of New York Governor Andrew Cuomo, has coronavirus. In fact, it seems like even with lockdown, this thing has been spreading like wildfire. Well after the lockdown, we watch it still, just at its peak in Italy. We've been locked down in New York. It's still peaking. Is it possible that everyone's just going to get this illness anyway? Would I be exaggerating if that was true? Look at what it says on the CDC's own website. The CDC expects that widespread transmission of COVID-19 in the United States will occur. In the coming months, most, not some, most of the U.S. population will be exposed to this virus. So will we be able to say that the quarantine worked? Or will we have to accept that we all actually just had coronavirus, we have herd immunity, so we never have to worry about it again? Sorry for being really dramatic about it, just like we were back with H1N1.